Hello to our listeners. Today we're interviewing Associate Professor Reza Nosrati, who is working as an engineer in the Department of Mechanical Engineering. He is an expert in microfluidics, fertility research, and bioengineering. Welcome.
Hello, and thanks for having me. I'm very excited to have this chat and hopefully give some information about the biomed and its future to some of our undergraduate students.
Great. So can we start with hearing about your academic and professional journey?
My background is actually mechanical engineering. I did my undergrad and master's back in my home country, Iran. Then I moved there to Canada for my PhD at the University of Toronto. That's where I started to work in the infertility area. I think PhD journey was quite an exciting, at the same time stressful journey at the beginning. And I think that's something people in the biomedical area share, because you need to know engineering, but also you need to know a lot of biology and medicine. And I think for me that was the most challenging part. And then after my PhD, I started 2012, finished 2016, and then I think almost a year into my postdoc, I got the position at Monash to start in 2017. But then my visa got delayed, then I got it in 2018, and then I joined Monash at 2019 since now, almost end of 2018. Yes.
And so what inspired you to specialize in small-scale fluid mechanics and microfluidics?
I guess I always had this big interest in the biomedical area and application of different tools and techniques for human health. I think that's a big deal. That can significantly impact the quality of our future generations. And when I started to work in the infertility area, I just learned more and more about how there's a significant emotional and financial burden to infertile couples. But just because of the nature of this issue, which is not being considered as one of the most important medical or health concern, there's not enough support mechanism around it, particularly if you go outside of Australia. I think Australia is pretty good in that aspect. Then that's a massive gap. And when you look at the operations in that area, they're extensively manual, they're very subjective, and as engineers, we're great in controlling things and automating things. And that was a great fit, and I started to work in that area, and I think it's rewarding. The attention we received encouraged us to just do more.
And so your work has gained significant international recognition. What do you think makes it stand out?
Great student like you guys. I think that's I think the research quality in any group is just as good as the student. I guess I want to recognize that all of those papers at the end of the day, it's a significant contribution from those students. But if I want to think about why we can achieve such an impact, I think it sits back at what I answered to the previous question. The area we're touching and exploring and understanding, it's quite an unexplored area, and almost every research question that we target is something that hasn't been done before, which means that it's kind of sitting at the forefront and the cutting edge of the field, which of course means that the outcome would be very rewarding for the student, but also I guess the student go through a lot of challenging iterations, and they really need to figure out the methods and techniques for those measurements. But I think because we're novel, we're unique, and we have the cutting edge tech that help us to receive that attention.
And so for the students that are hearing about your work for the first time, how do microfluidic technologies improve the selection of high quality sperm for assisted reproduction?
When we look at the conventional practices, and that's a great question, I think, thanks for that. When we look at the conventional practice, it's mainly based on beaker size processing of population level samples, which means that, let's say, if they want to select a high quality sperm cell, they're picking one or two out of samples which contains hundreds of, or even sometimes hundreds of millions of cells. then it's extremely high throughput selection. If you want to analyze, let's say 200 million cells in 10 minutes, you're basically dealing with a sorting rate which is more than any other sorting technology out there. That's where microfluidics is a perfect fit, because we can bring in a very controlled environment. We can isolate things at the single cell level. We can bring in the right geometry and right rheology of the fluid. Then we have a parallelized sorting and analysis platform, and at the same time we can very closely match the in vivo environment. This gives us two competitive advantages, I believe. One is we have the highest sorting rate possible, and then the second thing is, because we can very carefully mimic the in vivo environment, we understand cell response and cell behavior in physiologically relevant environment, and that's something again which wasn't being done too extensively before our work in the field.
And what are the biggest challenges in translating this microfluidic fertility research into widespread clinical use?
In terms of, I think the biggest challenge, microfluidics in general, is translation. That's the biggest challenge. Definitely for us, that's also the biggest challenge, because when you want to move things outside of research laboratory to a clinical setting, it means that you need to go through commercialization and translation. And maybe that could be something helpful for most of the biomedical engineering student to keep in mind. I think Australia is in a very exciting phase. We're having a lot of startups. We're having a lot of companies interested to bring their R&D side to Australia. Then I think if the student can somehow cover some aspects of, also the business and commercialization and translational aspects, entrepreneurship activities, I think that would be massive, and that can help the field in general. That's our biggest challenge, indeed.
So do you think that the next major breakthrough in this field will relate more to the science itself, or maybe more to the business healthcare area?
That's $1 million question, I would say. I think I can answer it in a way that I see the vision behind my lab, let's say 10 years into the future. I think the role of mechanical stimulation, which means that the forces that viscosity or confinement induce in vivo, has been completely ignored, not only in infertility, in any other field. And we recently have some results that show that these forces change the biochemistry of the cell, change signaling pathways, change their behavior. I think future would be more towards leveraging these changes as a tool to improve our detection, our diagnosis, and our therapeutic capabilities. I guess that's where the field is going to go in 10 years.
Okay, very cool. And what role does computational modeling play in your research?
Computational modeling, I think we do sometimes use like the traditional way of modeling fluid dynamic systems to understand the flow field. But I think we're more recently getting, I guess, more into its machine learning rather than computation, because I think it gives us massive opportunities in terms of analyzing a lot of data, and then moving again towards single cell level quantitative analysis. When we get the single cell level data, you also need to do quantitative analysis, and machine learning can standardize and automate that too. So I think that's where it kind of merged to our microfluidic platform.
Okay, and so the technologies used so a lot of the technologies that we learn in biomedicine, in our biomedicine subjects, have to do with personalized medicine. So again, I expect that this is an area that will fit in that category as well.
Great question. When I said 10 years into the future, how I see the field change, I can see how I can imagine, and that's the plan for my research. Maybe in 10 years in future, I've done it, and then that's great, or we change direction, we'll see. But I think personalized medicine, super important field in all area, cancer treatment, diagnosis, everything. In infertility in particular, the vision I have for my lab 10 years into the future is you don't do IVF cycle. You pick a cell from the male, you pick a cell from the female, and then you use mechanical stimulation and fluid dynamics to trick the cell in a way that instead of making sperm and egg, you make an embryo right away. That's what I'm trying to achieve maybe 10 years into the future. Then that means we will have new treatment option, completely new, distinct from existing one. We'll see if we can do that.
Okay, let's look forward to then. Now, this is a bit of a random question, but we've asked the other lecturers about it, and maybe you have an answer for this. So, have there been any biological systems that have particularly influenced your work, in the sense that nature is often inspired by bioengineering solutions?
Of course. I think you don't want to reinvent the wheel. Definitely you don't want to reinvent a good wheel. And that's where we learned a lot of, I think especially at the beginning when we started to look at more detailed analysis of flagellar movement and locomotion at micro scales. Most of our motivations came from the work that have been done extensively in the bacteria world. It's either microbial motility. I basically admire Raman Stoker group, who's now at ETH, and then they look at microbial motility in oceans. Then you have flow environment, you have a lot of chemical signalings, and then the bacteria needs to move around. So we studied those work quite extensively, and we learned from those type of work quite a lot.
Very cool. Now we're going to transition to asking questions about teaching and advice for students. So first of all, what motivated you to transition into academia and mentoring in biomedical engineering?
Passion. I think it's a very simple answer for me. That's what I love, that's what I enjoy. And I think whatever you want to do for the rest of your life, you need to really enjoy it, because that's the only way to do it good. Yeah.
And so for students interested in microfluidics and bioengineering, what skills or areas of study would you recommend they focus on?
I think knowing cell biology and fluid mechanics deeply, it's a very critical skill for any biomed student. And then linking it, moving towards more of the modern area, linking it with some computer programming. It could be either for image processing and analysis, or machine learning. It's another exciting area. And of course, control system and robotic system is also an exciting area. Can you repeat your question again?
Well, what skills or areas of study would you recommend they focus on?
Yeah, and I think I try to cover it in the unit that I develop. I don't know how much people like that, but I believe microscopy, visualization, and quantification of different phenomena at the single cell level. These skills could be quite crucial. Monash is unique, I believe, in that aspect, because we kind of cover some aspect of those really detailed microscopy methods or cell staining methods as part of our undergraduate education. Then if the students find them interesting, they can join one of the groups on campus for their FIP project and then get real hands-on experience. And I think that's very unique for them. Yeah,
well, the next question I was going to ask is, how can students get involved in research projects at your lab?
I guess the answer from my lab and everyone else is the same. It's always a start from an email. You send an email. I know people post projects on the Monash portal, but I would say if you really want to work with someone, it's either my group or anyone else. The best way is to just reach out to them. Ask to go and see their lab. I would love if a student dropped by and wants to visit my lab. That's the fun part of my day. Then I think every other academics is the same. Reach out, go visit their lab, see the environment, and if you feel good and you feel I want to work in that environment, then we'll have a chat about different projects. I guess that's how things go.
Great. And so now the questions that we wanted to ask are more about, picture yourself when you were a student, so that you can think of the students nowadays.
Wow, okay. I think changed quite a lot, but anyway.
So what do you think is the most challenging aspect of working in microfluidics or assisted reproductive technologies, and how do you think students should prepare for it?
I think it's a good, difficult question. I believe I think doing everything, including studying 20 years ago when I started my undergrad, was simpler. There was less things happening.
Less distractions, do you mean?
I mean, I think the modern word, the current word, it's very, internet and access to information, it's becomes much more quicker, and everyone can do different things much quicker. Then I believe the most difficult challenge for our current student is they need to do much more to stand out if they want to, get into a PhD program or get into a good company. And I believe two things that can help with that is for the student to learn at least one or two skills really well. You don't need to know everything, but I think you always need to know one or two things really well. That's the helpful things that can help them to stand out. And then the second thing is they need to learn to be much more efficient with their time, because they need to compete with other people's and that's a skill that I think in long term can make their life very stressful if they don't have it. Then this is my two suggestions. Practice managing your time, and then practice learning one or two things really deep. It can be biomed, robotics, coding, doing a specific type of measurements. I think that those are helpful.
Yeah, no, that's great advice. And so, your career has, it's gone through a lot of stages of going to different countries, meeting different people. And so what roles do you think that interdisciplinary and international collaborations play in advancing your area of research?
Massive. I think it's been crucial. The fact that I was able to establish this relatively large network of collaborations helped me quite a lot. I have collaborations with reproductive biologists, andrologists, engineers. I think then it was very helpful, but at the same time, let's keep in mind that it's a very difficult thing to do, to relocate and move. And I always, whenever an opportunity came for me to move, I thought because it's now, let's say, with a job or with a better salary, it's going to make it easier. That is not the case. It doesn't make it easier. It's still difficult. But I think everything in life is like that. Whenever you want to gain something, you need to lose something. Then everything comes at a price. And I guess the key thing is I need to accept that to achieve this, I need to maybe compensate. I always, even for my PhD students, I love them to stay in my lab as a postdoc because they're the best postdoc I can have. But I always encourage them to move around, because you want to move around, you want to see different groups, you want to see different environment, different countries. And that gives you a very broad perspective, because then you can pick all of the good things about those experiences and then maybe make a better system. And of course, you can also avoid a lot of bad things. And still, there's always surprises. Yeah.
Great. It's really good to know your insight on this, given that you've moved around and have had that experience. So to finish off, we've got some fun questions, as we call them. If you could work on any futuristic microfluidics project with unlimited funding, what would it be?
I will bring in genomics, multi-omics together with carefully controlled microfluidic platforms to measure cell changes at the single cell level, and then link it to how this change DNA structure in the cell. That's basically the research plan for the next 10 years to see if we can do that. It's a massively expensive research, and having unlimited funding, we'll get it done in 10 years if I get that. Yeah, I'll promise that.
Okay. And do you have a favorite scientific discovery or experiment that has influenced your career?
I think I can't really pick one, but I would say I'm the type of a person who like to have role models. And there are a few people in the world that I really admire their work and follow them. Of course, my PhD supervisor, David Sinton at the University of Toronto, I think they've done a lot of different discoveries in Bayer. And I also follow David Waits and George Whiteside at Harvard. They're the people who basically started the microfluidic field. David Beebe at Wisconsin-Madison, someone who do a lot of simple microfluidic devices. I think his focus is to do things in a simple way. Then I learned that part from him. I guess I followed these work from these groups quite a lot, and a lot of time. Many of those groups, they're moved to do different things, and they're not working really in infertility area and application of microfluidics. But you can see how they change their methods and techniques, let's say for cancer or other fields, and I bring them over. I think those are the works that I really, follow.
Yeah, no, that's
and I
fair.
can't pick one. Yeah.
And if you weren't a biomedical engineer or a researcher, what career would you have pursued?
I would become a specialist, a surgeon.
Oh wow, okay.
Yeah.
In any area in particular?
I kind of feel it probably would have been in the cardiovascular or a neurosurgery, but
Yeah.
I don't know, it's just a guess. I feel if I wouldn't do this, probably I would go that way.
Okay, interesting. And so to finish off, outside of research and teaching, what are some of your interests or hobbies that students might not know about?
I play PlayStation quite a lot. I like video gaming. It's like my break time, and I can turn off my brain and just think about something else. I quite like, going to, swimming or things like that. And I guess that's the my outside of university activities. Then
Nice.
hopefully they're quite unusual. I don't know.
No, I mean, maybe you'll get some students asking about your research, but you might get students asking about what games you play.
Oh, what games I play? It depends on whether or not my week was good or bad.
Oh, wow.
If it's a bad week, then probably one of those war games, because then you can get it out of your system. If it was a good week, then like a sport, soccer game or things like that. And usually it depends also on my wife too.
Okay.
She can override the plan, then that's the thing.
I'm sure a lot of students will resonate with that.
Yeah, definitely. Yeah.
Okay, well, thank you so much, Reza, for this interview. I hope that now students feel that they know you a little bit more and more comfortable with approaching you after class. And I'm sure that you would also be very happy to have them come to you at any point.
Yeah, definitely. Thank you for this very interesting interview. I hope it's helpful, and I look forward to see more of the biomed students.